Scanning my environment. Okay. So before going into the patient's room, I would perform hand hygiene. I would verify the patient's order on the MAR. I would check to see if the patient had any allergies or contraindications. I see that he has none. I check for any discrepancies. I see that there are none as well. I would then go ahead and get the medication. So I see first one, Tylenol, one tablet, 730, and by mouth, okay? I would get my syringe, uncap it, and I see it's insulin, 4 units, subcutaneous, 730, okay? And I would put it back in one swift, and I see that it matches. I would then do any med calculations, and then I would have a nurse come and verify it for me. I would then go ahead and do another med calculation. So I would see I would see Tylenol, by mouth, 730, one tablet. Then I see insulin, 4 units, subcutaneous, 730, and they all check out. So I would go to my patient's room. Knock, knock. Hi, my name is Ashley, and I'm going to be your nurse today. I will be giving you your medication, and then I will make sure and go ahead and teach you about any reactions that you will need to know. It is now a good time to do so. And do you have any questions for me? Okay. I place my equipment on a clean surface. I perform hand hygiene, and I close the door for privacy. Can you please verify your name and date of birth for me? Okay, and sir, I just want to confirm that you have no type of, any drug allergies or contraindications. The patient says no. I go ahead and perform the physical assessment, and including his vital signs. I would then test his ability to swallow, and then I would do med calculation number 3. So I see Tylenol, by mouth, one tablet, 730, for Mr. Dog. Then I see insulin, subcutaneous, 730, 4 units, for Mr. Dog, and this is Mr. Dog. So everything checks out good. I would then go ahead and perform hand hygiene. I would don gloves. I would then go and inspect the patient for any lesions. Inspect his subcutaneous area for any lesions, any inflammation, bony prominences, or trauma. I see he has none, so I would go ahead and cleanse the site. I would let it dry. I would then go and get ready, and I would tell Mr. Dog, I'm about to eject you, so get ready. I would squeeze his site, and I would stick it in a 45 to 90 degree angle. I would release the subcutaneous tissue, and I would get hold of the syringe and inject slowly. I would then remove it at the same angle. With my non-dominant hand, I would get a gauze. I would then check for any bleeding or any redness or reactions. I see the patient has none, so then I would go ahead and bandage it. And before that, I would make sure I activate my syringe and discard of it in the Star's container. I would then now remove my gloves, perform hand hygiene. I would elevate the bed to at least a 30 degree angle. I would give him his oral medication in a container with some water. He takes it, and I see that he has swallowed everything. So I discarded everything, and then I go ahead and place him back in comfort. Then I would perform hand hygiene. I would lower the bed to its lowest level. I would lock it. I would then raise the side rail, put his collar within reach, perform hand hygiene again, and I would go doggy